Hi, this is Anyasha, and today I am going to discuss about legal implication in medical tourism. So, what is medical tourism? Medical tourism is traveling abroad to get medical treatment is becoming more popular in USA in few decades. The medical tourism market is expanding worldwide is approximately around 105 billion and is projected to reach around 200 billion by the year 2027. The rising cost of healthcare over the years in USA promoted the scope of medical treatment and medical tourism in different countries, in different foreign countries. Advancement of IT and frequent international visits by US citizens altogether aggravated the situation, the occurrence of US person being treated in foreign countries. It is also noted that individual having medical insurance may also opt to travel to different countries, different foreign countries for a cheaper and more convenient treatment. And the countries such as Asia and Latin America, people are going, US citizens are often traveling to these countries for the cheaper medical treatment and convenient surgical procedures. So, however, people face lot of difficulties which sometimes create legal complications during any medical treatment in foreign countries. The post operative complications caused by any such medical treatment may or may not be covered by the existing insurance of the individual. Such scenario would be extremely critical and would potentially be a factor in the reduction of medical tourism of US citizens. The major market of medical tourism is lied in the developing countries such as Dominican Republic, Mexico, Middle Eastern countries, Thailand, India, etc., which are known for the cheaper surgical procedures and cheaper medical treatment. A large number of US patients are visiting low and middle income destinations to get surgical procedures such as organ transplantation, knee transplantation, in vitro fertilizations, etc. From mild to moderate levels of complications arise when treatment or any procedures involving routine or complex surgical method are at fault. Suppose an example I am giving people which those who are like US citizen is traveling from to some other countries for some treatment like knee replacement or in vitro fertilization or kidney transplant, and then after treatment, prolonged treatment, they are coming to USA, and then after that they are facing some complications, and the complications may be like post operative infection like the bacteria which still recurred, and at that time, so the main question arise like during that time will they travel to that specific foreign countries where they got treatment, or they will be staying in USA and get some more recommendation for some other doctors. But sometimes this doesn't happen because without the consent, like when a person is treated to some foreign countries, sometimes they are given some forms, some medical forms, where they need to fill up the forms, and they don't know what are they fill up, they are writing like without the consent of them, like the tissue or the stem cells they have taken, or without their consent they had done some treatment without their consent, like some surgical procedure. And while they are consulting to the US doctors, they are clueless, or they don't know like whether they had filled up this form without their consent. And also there may be no medical records, no update of EMR. So this can be a legal complications, like how the USA doctors will treat the patient, those who already traveled some other countries for the treatment. So these kind of getting legal implications on the patients as well, like the doctor also become clueless, like how they will treat the patients. So this can be some legal issues. Any operative procedures have a chance to develop complication caused by opportunistic microbial infections, which I just spoke about. So, the legal complications associated are related to insurance coverage and role of US healthcare system. It is still legally complex whether the existing insurance would bear the cost operative like post operative or therapeutic complication. It is also to be noted sometimes patients are not given informed consents during any medical procedure like organ transplantation or cell therapy, which I just told about. So it is expected that USA and other countries create a treaty to protect the US patients during their visit for the treatment, for the medical treatment. So I would like to conclude with an example where the US patients having bariatric surgery in Mexico had severe post-operative infection which created trouble in US healthcare system. And also I would like to conclude for some other thing as well, like when they are traveling to some other countries, I think there should be a translator in every country, so that the language barrier or the consent form should be explained to the patient. So that's all. Thank you for watching this.